If you have an itchy rash in your groin, you might have jock itch. In this short video, we're going to cover how you treat something called jock itch, also known as tinea cruris, is a fungal infection that affects the skin of the genitals, inner thighs, and buttocks. It is characterized by a red, itchy, ring-shaped rash and is caused by fungi called dermatophytes, which thrive in warm, moist areas. Common symptoms of jock itch include red, ring-shaped rash. Typically appears in the groin area and can spread to the inner thighs and buttocks. Itching or burning. Persistent itching or a burning sensation in the affected area. Flaking or peeling skin. The skin may become flaky or start peeling. Raised, scaly edges. The rash often has raised edges that may appear scaly. Spread of rash. The rash can extend outward from the groin, often creating a clearly defined border. Jock itch is caused by a group of fungi known as dermatophytes. These fungi thrive in warm, moist environments, making the groin area particularly vulnerable. Factors that can contribute to the development of jock itch include excessive sweating, tight clothing, poor hygiene, and sharing personal items such as towels or clothing. The infection is more common in people who are overweight, athletes, and those with weakened immune systems. Dermatophytes can spread through direct skin-to-skin contact or indirectly through contaminated objects, further increasing the risk of infection. Keep the area clean and dry. Maintaining cleanliness and dryness in the affected area is crucial for treating and preventing jock itch. Follow these steps. Regular washing. Wash the affected area with soap and water at least once daily. Make sure to do this after physical activities that cause sweating. Thorough drying. After washing, thoroughly dry the area with a clean towel. Pay special attention to drying the folds of the skin. Avoid moisture, buildup. Change out of sweaty clothes as soon as possible. Opt for moisture-wicking fabrics that help keep the skin dry. Use a clean towel. Always use a clean, dry towel to prevent reinfection and spread of fungi. Avoid tight clothing. Wear loose-fitting, breathable clothes to reduce moisture and friction in the groin area. Choose cotton underwear over synthetic fabrics. Over-the-counter, OTC, antifungal creams. Using OTC antifungal creams is an effective way to treat jock itch. Common options. Look for creams containing clotrimazole, miconazole, or terbinafine. Application. Apply the cream to the affected area as directed on the package, usually twice daily. Duration. Continue using the cream for 2 to 4 weeks, even if symptoms improve before the treatment period ends, to ensure the infection is fully eradicated. Ensure the skin is clean and dry before applying the cream. After applying the cream, wash your hands thoroughly to prevent the spread of the fungi to other parts of your body or to other people. Prevention tips. Taking preventive measures can help reduce the risk of developing jock itch or prevent its recurrence. Follow these tips. Maintain good hygiene. Shower regularly, especially after sweating, and thoroughly dry the groin area afterward. Wear loose-fitting clothing. Opt for breathable fabrics like cotton and avoid tight clothing that can trap moisture and heat. Change out of wet clothes. Promptly. Remove wet or sweaty clothing as soon as possible to prevent moisture buildup. Use antifungal powder. Apply antifungal powder, especially in areas prone to sweating, to keep the skin dry and inhibit fungal growth. Avoid sharing personal items. Refrain from sharing towels, clothing, or other personal items to minimize the risk of spreading fungal infections. Practice good foot hygiene. Since athlete's foot, tinea pedis, can spread to the groin area, maintain good foot hygiene, and treat any foot fungal infections promptly. Keep the skin dry. Pay attention to areas prone to sweating, such as the groin and armpits, and keep them dry to prevent fungal growth. Regularly wash and replace clothing and bedding. Wash clothing, towels, and bedding regularly to prevent the buildup of fungi and bacteria. Avoid walking barefoot in public areas. Fungal infections can spread through direct contact with contaminated surfaces, so wear flip-flops or sandals in communal showers or locker rooms. By following these preventive tips, you can reduce the risk of developing jock itch and maintain good overall skin health. When to see a doctor. While jock itch can often be treated effectively at home, there are situations where it's important to seek medical advice. No improvement. If the symptoms persist or worsen despite home treatment, it's advisable to consult a healthcare professional. Severe discomfort. If the itching, pain, or discomfort becomes severe and interferes with daily activities, medical attention may be necessary. Signs of infection. If there are signs of a secondary bacterial infection, such as increased redness, swelling, warmth, or pus, it's important to see a doctor promptly. Recurrent infections. If jock itch keeps recurring despite following preventive measures and treatment, a doctor's evaluation may be needed to explore underlying causes or alternative treatment options. Weakened immune system. Individuals with weakened immune systems, such as those with HIV/AIDS or undergoing immunosuppressive therapy, should seek medical advice promptly if they develop jock itch. Unsure diagnosis. If you're unsure whether the rash is jock itch or another skin condition, it's best to consult a doctor for an accurate diagnosis and appropriate treatment plan. Overall, if you have any concerns about your jock itch symptoms or if they persist despite home treatment, it's wise to seek guidance from a healthcare professional. If this video added value to your health journey, please like and subscribe to Fit&Fab. Stay fabulous and see you next time.